Cefazolin is an antibiotic used to treat severe infections. The onset is 10 minutes, the peak is at infusion's end, and the duration is unknown. The side effects include headache, dizziness, and nausea. The nursing considerations would be monitoring the patient for any signs of allergic reactions and assess the patient's vitals. The health teachings I would give to my patient are to notify the nurse immediately if you notice any rash or have any difficulty breathing. Within the administration of IV medication policies and procedures document, it states to verify the ordered dose, frequency, volume, rate, and method of administration and or duration of infusion time that are authorized by the Lakeridge Health IV monograph. It also states that if the duration of the infusion deviates from the medication deviates from the Lakeridge Health IV monograph and or the healthcare practitioner has a concern with the safety of the medication order, the procedure outlined in the disagreement plan of care and escalation procedures is to be followed. So at this point, I'm going to review my patient's chart. So I have Sid Garland here. He's a 54-year-old male that's been admitted to the hospital for a below-the-knee amputation of his left leg. Post-op, he has a large amount of serosanguinous impurulent drainage. His vitals are a temp of 38.5, heart rate's 110, respiration rate 18, blood pressure 120/75, and OT sats of 98% on room air. The patient rates his pain as a 7 out of 10. His lab results came back. He has a high white blood cell count of 25.7, with the normal range being between 4 and 11. This would be an indication of Mr. Garland fighting off some type of infection. So we are waiting for an order of IV antibiotics, and those antibiotics have now come in. So at this point, I would sign my signature sheet with the date, print my full name, my status, signature, and my initials. I'm going to verify now my doctor's order with my MAR. I'm going to do that side by side. So I have Sid Garland, MRN number 344316, MRN number 344316. Date of birth is 11/08/1965. Date of birth is 11/08/1965. His allergies are codeine and penicillin. The medication is cefazolin, and cefazolin 500 milligrams is the dose, 500 milligrams. The route is going to be IV, and the route is IV. The frequency is every 8 hours for 7 days, every 8 hours for 7 days, and the next time is 0600, and that's what I'm going to be giving. On my doctor's order itself, it states for my mainline solution and rate to start the IV, normal saline at 125 mils an hour. My monograph here, it says dilute in 50 to 100 mils of an IV solution and infuse over 10 to 60 minutes. I called the pharmacy, and they're saying that I should dilute it in 50 mils of normal saline, so that's what I'll be doing, and I'll be giving it over 45 minutes because this patient has not received this medication before, and we want to administer it at a longer rate so that we can observe for any severe adverse reactions to the medication. For the compatibilities, I see that it's stable in sodium chloride. My main line and mini bag are the same, so they're compatible. Cefazolin is running, so there's no med-to-med compatibility issues because it's running by itself with no other medications. Cefazolin is compatible with normal saline, and the diluent is normal saline. There's no medication, so there's no medication to diluent incompatibilities. The IV main solution is normal saline, and it's compatible with cefazolin. I'm now going to go into my patient's room to assess the IV site and the mainline solutions to make sure everything's okay before I get started preparing with my medication. So I'm now in my patient's room. I'm going to check the mainline solution and the IV site itself. So I'm going to start the mainline solution here. So I'm noting that it's sodium chloride, and that's what's on our doctor's order. The expiry date is December 2020, which is great. It's not expired. I'm checking the clarity of the bag and the color and checking for any leaks, and that seems to be all right. The IV itself is running at 125 mils an hour, which again is on our doctor's order, so that's great. I'm gonna fall down now. The IV tubing is labeled as it was changed today, so it's still good. As I work my way down, I'm gonna look at my clamps, and they're both open. I'm gonna continue down the line here, and I'm gonna check for any bubbles or kinks, and I'm gonna follow it all the way along until I get to my IV site. So upon observation of the IV site, I'm not seeing any leaks. I'm not seeing any type of swelling. I'm going to palpate the area and check for any swelling, any warmth, any signs of infiltration or phlebitis, which I do not see. So on the grading score for this phlebitis and the infiltration, it would be a grade of 0. And the clamp is open here at the IV site, so that's also great. My pre-assessment for my patient would be to see if he's had this medication before, let him know of any side effects that they may cause, and any adverse reactions that he should report immediately, and we would do a set of vitals before we start the medication.